want to buy some product, make an ad. Who are the people who will come for that ad is your role models. It either might be your cinema role model, it might be your sports role model, it might be your community role model. In some certain community, certain role models will be there. They will call them and make the ad. You see the person, whatever he uses, same you will buy. This is called social engineering. Social engineering is common people what they like. They will identify that. With that, they will introduce new things. For vaccination purpose, they will make some advertisement. Have you seen government advertisement for vaccination? They make sure that all the children who are born are getting vaccinated. Social engineering is a manipulating staff members. So there are people who manipulate on your health for better reasons. This is not only for health. In recent days, number of fake websites are there. Virus threats will be there. These things are also called social engineering. If you connect to certain Wi-Fi, you will get affected with this virus. This is one of the reasons. It might be routers, computers, etc. I am not going to discuss with you detail on computer oriented. Social engineering for health. I am going to currently discuss on that. Profile here. Some photos are here. You just click here. It will come like that. If you click that, immediately your data will be backed up by the person. So those who are here. Some offers they will give. TV, free mobile or free TV, give this feedback. If you give feedback, you will be a luckiest person. You will get that. If you click that, automatically the data will go. These are some of the example of social engineering. But today's class is what? Changing health behaviors through social engineering. For health benefits, how to use that. So this is what today's class. And by this you can modify environment. So I have told two types of psychology. One is individual psychology, another one is social psychology. What are the example of social psychology is making a friendship. Friendship is a social psychology because you need 2% to make friendship minimum. So how people choose their friends, it is a sociology. Have you seen government are giving for 5 rupees they are giving purified water for drinking. The government is taking initiation for making purified water and banning of smoking. In public place, no one can do this. So this is a ban. In social places, they have made this ban so that this is one of the things. Banning of drugs. So it is not available legally and lowering speed limit. Have you seen speed limit signboards when you go towards highway? Why they are providing is, this is one of the response of government in order to reduce accident. They will mark that place wherever the accident happened. That place, if frequent accidents are there, they will keep a signboard. So this is the best way of social engineering. That means getting aware of people. How to create awareness? This is one of the way. Lowering speed limit and helmet safety laws. See, you want to wear helmet. Primary reason is safety. But most of the people who wear the helmet and seat belt for reducing the penalty. For that only they are wearing. That is the secondary reason, but that is the primary. How the government made you to wear the seat belt is, they have not asked you. If the government is asking you, dear people, please wear seat belt. If the government is saying, will you wear the seat belt? But we have to do certain rules, norms, regulations. Why? Because at the end you will be benefited. For that regulations are there. So in the legislation they have drawn that for seat belt 2000, for helmet 500. From legislation it comes, then it automatically you see maximum of the people wear seat belts and the helmet. So this is the example of social engineering. Have you seen vaccinations are given by colleges? Have you seen schools provide vaccination? Yes. Why? Because vaccination is required for whom? Children's. For the children's, the government will take initiation for schools only. Respective all the schools, those who are under 8, they will call the people. In that school, they provide vaccination. This is called social engineering. Like that, government will also take initiation for this. So individual left by no choice. Those who are studying in that school have to have the vaccination. They have a very little choice of responsibility due to their behavior. how to make common people to get benefit is through legislation. During COVID, everybody has to be vaccinated. Government has to make sure that everybody had that vaccine. As soon as you are vaccinated, some message will come to you through your Aadhaar card. That message the student has to send to the college. Through that, we have monitored that all the college students are vaccinated before they arrive to the college. The government will ask when you are going to any flight, the government will take initiations with that. For making a healthier choice, they will make certain social engineering, information of resources, etc. And then they will make cheap fruits and vegetables. If certain things are healthy, how to promote is making it cheap. Where you can do is, you can choose venues. What are the venues? Are workplace. If certain healthy behaviors are there, stop smoking is a healthy behavior, eat healthy diet is a healthy behavior. You have to promote. In your college, you have to promote healthy eating behavior. We know that we have to have carbohydrate 30%, protein 40%, fat less than 30%, etc. But how to make it as rule and norm so that we will get benefited? We make a canteen and whatever foods are available there, can we make that healthier? Whatever things are available in our campus, we have to control that. How we can control? Reducing the soft drinks. Whatever is dietary recommended has to be sold. If you are going to theatre also, whatever is supplied in theatre, you have to buy that. This can be used for positive and negative aspect also. Microsoft, Google campus, if you go there, only healthier meals are there. No artificial things. If it is not recommended by government, they will not supply there. How to make the children or adults to have a healthier diet is by supplying that in a particular venues. Those venues are schools, colleges, etc. has to be having a healthier meal. By that, we can promote that. So, this is an indirect way. Working site interventions, 70%. How much they have reached this? 70% those who are employed, they are optimized. These adults has been optimized through that. Banning smoking, healthy meals served, special incentives. Those who are having that meal will be getting 10% off. Number of meals they can provide. Those who are preferring healthier meal, 10% off, 20% off. If they are providing with that, that is indirect way of social engineering towards health. Next thing, community based intervention. In Northern Carolina, they have done this social engineering. They have reduced smoking 18% for male, cholesterol, then BDP, CHD, cardio health disease. So these things they have reduced only by making this social engineering. Door to door campaign, media blitz. That means providing informations in media, television, etc. Large scale expensive programs have been controversial. They will make program, music event, audio launcher, movie launches, cricket, etc. There, these are all the places where community based interventions. Those who like that sports will come to that community. If you go to football ground, those people love football will come there. There you can promote in cricket, etc. with the theatre. Like that, these are all community based interventions. Have you seen when you are going to any cinema theatre, smoking causes cancer, drinking alcohol is banned. Why they are promoting? Social engineering. That means government has that responsibility so that to reduce the ill effect of the health, they are making this kind of community based interventions. So they will promote it at all the places. Next thing is mass media. Larger number of individuals you can reach that. What is the disadvantages if you want to promote health related thing? If you are only just posting in social media or mass media is, it will take initial 1 hour. See, whatever message if government sends you in social media, within 5 minutes or 10 minutes you will be aware. But after that, next message you will go, forget that. This is the disadvantage of this. But there is less long-term behavior. Whatever the change they have to bring in mass media will be not last longing, it will be longing for lesser time. Most effective, altering people health risk, cumulative effect on changing values can be changed. So cumulative effects are, it can enhance the rules and norms, but only through social media you cannot make something to happen. So promoting, utilizing tools,